What's up, guys? Man who got the first pig heart transplant dies after 2 months. The first person to receive a heart transplant from a pig has died. 2 months after the groundbreaking experiment, the Maryland hospital that performed the surgery announced on Wednesday, March 9th. 57-year-old Daivd Bennett died Tuesday, March 8th at the University of Maryland Medical Center. Doctors did not give an exact cause of death, saying only that his condition had begun deteriorating several days earlier. Doctors for decades have sought to one day use animal organs for life-saving transplants. David, who worked as a handyman, was a candidate for this newest attempt, only because he otherwise faced certain death. He was ineligible for a human heart transplant, bedridden and on life support, and out of other options. After the January 7 operation, David's son, David Jr., told the Associated Press his father knew there was no guarantee it would work. Prior attempts to such transplants have failed largely because patients' body rapidly reject the animal organ, but this time the Maryland surgeon used the heart of a gene-edited pig. Scientists had modified the animal to remove pig genes that trigger the hyperfast rejection and had human genes to help the body accept the organ. At first, the pig heart was functioning, and the Maryland hospital issued periodic updates that David seems to be slowly recovering. Last month, the hospital released a video of him watching the Super Bowl from his hospital bed while working with his physical therapist. David survives significantly longer with the gene-edited pig heart than the last milestones in the xenotransplantation, who was a baby called Faye. The dying California infant lived 21 days with a baboon's heart in 1984. The need for another source of organ is huge. More than 41,000 transplants were performed in the U.S. last year, a record, including about 3,800 heart transplants. But still, more than 106,000 people remain on the national waiting list. Thousands die every year before getting an organ, and thousands more never even got added to the list, considered to be too much of a long shot. The Food and Drug Administration had allowed the dramatic Maryland experiment under quote-unquote compassionate use. This rule is for emergency situations, much like David's, whose doctors said that he had a heart failure and an irregular heartbeat, plus a history of not complying to medical instructions. He was deemed ineligible for a human heart transplant that requires strict use of immune-suppressing medicines or the remaining alternative, an implanted heart pump. Although the doctors did not reveal the exact cause of David's death, rejection, infection, and other complications are risk for transplant recipients. Twice last fall, surgeons at New York University got permission from the families of deceased individuals to temporarily attach a gene-edited pig kidney to blood vessels outside the body and watch them work before ending life support. Also at the Alabama University, surgeons went a step further, transplanting a pair of gene-edited pig kidney into a brain-dead man in a step-by-step rehearsal for an operation they hope to try in living patients, possibly later this year. Pigs have long been used in human medicine, including pig skin grafts and implantation of pig heart valves, but transplanting entire organs is much more complex than using highly processed tissues.